To the extent that we live our lives in a manner that is consistent with the truth in our heart, we thrive.
Welcome to the Meier Clinic's podcast, and you just heard a quote from one of your hosts, Dr. Lisa Day. Join our licensed clinical professionals from various backgrounds as they discuss fascinating mental health topics with a wide range of guests. Meier Clinics is a Christian counseling organization with multiple clinics nationwide dedicated to treating the whole person, emotionally, physically, and spiritually. Welcome to our listening family. We thank you for joining us.
Hello, everyone, and thank you for joining us for another episode of Mental Health News Radio. Tonight, we are doing a very special show. We have Dr. Paul Meier on. Hey, Paul.
How you doing, Melanie?
Hey, doing good, and thank you so much for bringing us this special guest tonight. His name is Grant Davis, and Grant is a psychiatric nurse practitioner at Meier Clinics. So Dr. Meier knows Grant well, and we are going to talk about medication tonight. Always a popular topic, and we really hope to get some good information out there to our listeners so they can better understand exactly what medication does and doesn't do and benefits and all those types of things. So, Paul, why don't you get us started?
Okay. Yeah, for all of you in our listening family right now, we're not saying everybody needs medications because not everybody does. A majority of the people that come to our clinics nationwide for whatever problems they're working on don't get medications. But some people would fall apart without them. 20% of the population inherits either severe depression or some form of anxiety, obsessive compulsive disorder or other things that make them real nervous, and they'll never be able to function adequately without medication. So, in anxiety is one of the easiest things for us as a psychiatrist or as a psychiatric nurse practitioner to help. I can get a new patient that comes in that's been having panic attacks for 20 straight years, and maybe their doctor put them on an antidepressant that normally would help them and gives them 10 milligrams instead of the 40 that it normally needs or something. But they've tried things and nothing's working, and they don't really believe me when they first come in and they have severe anxiety and panic attacks like that. When I tell them, well, today's the last day that you'll have them, they think I'm kidding, because they've been trying to get rid of them for 20 years. And I said, no, it depends on, and I tell them it depends, I can load you up on stuff that'll get rid of them immediately, and then we can back off, or we can go slow and just build things up gradually. And so being a compassionate psychiatrist, I think of that old kid's story, where there's a lion in the street that's really mean and everybody's scared because he's got a thorn in his paw, and this little 6-year-old kid goes out there and pulls the thorn out, and the lion's not mean anymore. So when I see patients, I won't want to pull their thorns out. I don't want them to hurt anymore, and it feels really good to have them come back a month later and say, hey, this is the best I ever felt. So and some people most people with anxiety have spiritual and emotional conflicts that they need to work on, and some of them just want to get on meds and numb out and avoid working on them, and then there's other people that have so much anxiety that they can't function and they can't do counseling because they just they're just too uptight to even do that. And so, as a psychiatrist or as a nurse practitioner, what Grant and I need to do is figure out who needs meds, who doesn't, and do they want to go fast or go slow, and what would be the best thing for them. There's some things we give them just for the first few weeks while the slower things that are better are building up. So I'm not going to go into any medications because I want Grant's just brilliant. He doesn't like me saying that publicly, so I apologize, Grant, but I'm supposed to be supervising him. You know, he's a nurse practitioner at our clinic, and I'm supposed to be the boss supervising him. And I knock on his door once or twice a week, getting his advice because he's just so good and smart and compassionate. So thank you for coming on today, Grant.
Dr. Meier, absolutely. Pleasure to be here.
I'm done with my spiel. That's my spiel, my opening spiel.
I know I didn't even let Grant say hello or talk or anything. I apologize, Grant, but I was so excited about the show. I just jumped right in. So, yeah, give us your thoughts on what Dr. Meier just said.
Yeah, I think, Dr. Meier hit the nail on the head with that. I think that, there are a lot of people that come through our clinic, especially here in Richardson. Some will end up in mine or Dr. Meier's office, talking and discussing medicine. Some will start with therapy, and that's all they'll need and can really get some good improvement. But often they may start with therapy, but we'll get referrals from therapists that say, hey, I think you could really benefit from some medication. One of the things I get specifically from Christians or even non-Christians is just a fear of, is this medicine going to stunt or inhibit any type of processing that I would do in counseling? And, the medicines I would start somebody on, I say absolutely not. And in fact, I think it's going to help you to process some of these things you need to work through, because we can be so emotionally wound up that it can be very hard for a therapist to get past some of these things. You just keep rehashing over and over and over again, and the medicine can really just help bring that down a notch so that we can really get down to the deep stuff.
Hey, yeah, let me butt in here a second. What you said just reminded me of something. We've got a day program, as a lot of our listeners know, where people come 7 hours a day, 5 days a week for 3 weeks, and we dig and probe and do all the about 6 or 8 months worth of counseling. But Grant is the doc in charge. He sees them every single day, each client every single day, to ask them, about whether they need meds or not, whether they're having side effects and all that sort of thing. And something Keith Coburn is, Dr. Coburn runs the day program, and something I don't know if he's ever told you this, Grant, but he's told me several times. He says, now, Paul, when these new patients come in, don't relieve their anxiety so much they don't work on their problems. He knows I feel sorry for them, so I want to load them up so they don't have any anxiety and then sort of back off. That's sort of my natural tendency. But when they're coming in the day program, you don't want to give them so much that they just, I feel wonderful, I'm going home. I'm not going to stay here and work. So what you shared is, remind me of that.
Yeah. And that's very, very rare to it takes a lot of medicine to really get somebody where they just don't feel or care. And I think that is one of the big misconceptions or fears that a lot of people have when they've never been on any medication before at all. Is this, they're going to start me on these, that lovely term, quote unquote, antidepressant, this quote unquote happy pill that's just going to take all my cares away. And that's just not, what the medicines do, and not how they work. And, I try to explain to people, it's like, you should still be able to get appropriately anxious about things you need to be anxious about. Anxiety is protective, keeps you safe. But this excessive worry that you can't let things go, and you think about something over and over and over for hours, and you don't really get anywhere with it. And then that next day you're thinking, why did I waste 2 hours worrying about that? It wasn't a big deal. That's what medicine kind of helps to do, is it helps you to say this is not that big of a deal when rationally it's really not. And it can, help you to be present with your family and your loved ones and to not sweat the small stuff.
Mm-hmm.
Yeah. So, yeah, I think, Paul, you've said this on the show before that, any type of medication you're going to be taking for a psychiatric disturbance is supposed to make you feel more like yourself. And that's really what should happen. And if it doesn't, it probably means that it's just not the right drug for you. And I actually did an interview this morning with someone. It's so funny we're doing this show with you guys today, because this particular interview had been booked out several months because this doctor was releasing a book, but it was another interview about medication. So we'll have to try to not release those at the same time. But it's just one of the things I think a lot of times people have a bad experience, a bad side effect the first couple of times they take medicine, and then they're scared. They're already in this vulnerable position.
Yeah.
Then they take something and it makes them feel worse. And so then they're scared and they never want to try it again. And then sometimes just putting a pill in their mouth is enough to make them have a panic attack or be anxious. So it really
people
is.
with OCD especially.
Yeah, it's really delicate. I mean, when I think about, and Dr. Meier, what you said about Grant, I'm sure Grant does this too, but I think so many psychiatrists just don't explain these things to their clients. This is 10 or 15 minute appointment. You don't even really know what you're doing. You're handed a script and you walk out and you're just not educated. And that to me is so dangerous. At least, that initial appointment, they need to have an understanding of what to look for, and maybe even helping them understand a little bit more about body awareness and how you're feeling after taking the drug. So,
that's why we always do a 1 hour workup before we start seeing them for the 15-minute medicine checks.
Yeah.
And I always do that. I explain to them. I tell them. I say like if they really need an antidepressant, and I'll say, no, this isn't a happy pill. If you got 50 happy people and they took this, they wouldn't be any happier. It's not a happy pill, but you eat tryptophan in your diet, and the B6 carries it in the brain. The brain turns it into serotonin, and serotonin gives you love, joy, peace, patience, and good sleep. It gives you the fruit of the spirit and good sleep. And then you got 100 billion brain cells, and you got little spaces between them called synapses, and then you have reuptake sites that suck up the old serotonin to replace it with the new. And all this medicine does, it's a serotonin reuptake inhibitor. All that means is it blocks some of the drains so that the food that God's making in your brain and you're making by the foods that you eat, the serotonin can accumulate instead of getting sucked out too fast. And so what you're like on an antidepressant is just you with a normal serotonin level like you would have had if you wouldn't have inherited these suckers that are sucking up too much. And so, when they come back and they say, boy, I've never felt this good before, I tell them, well, that's not the antidepressant isn't making you feel falsely happy. This is the real you. This is what you're like on an antidepressant. Now, and like one of you said, sometimes the antidepressant will have, 75% of the time it works fine and there's no side effects and things. But sometimes, maybe with 1 out of 20 people or something like that, it'll numb them out where they just feel numb and they don't feel happy, sad, or anything. They just, and if that happens, then I switch to a different antidepressant because I want them to be themselves.
Yes, I think that's so important to point out. What do you think, Grant?
Yes, absolutely. I tell people the same thing. Is if you feel numb, feel anything other like that, that is absolutely a side effect, and I need to know about it because we will change it. That is definitely not the goal of treatment. But there's a lot of genetic variations in these psychiatric drugs. We Dr. Meier and her lovely nurse Lynn here in Richardson really try to talk a lot of our patients into getting a genetic testing thing done on the patients that come through our day hospital, because there can be a lot of genetic variations in the way that we process these psychiatric drugs that can really, in hindsight, it can make a lot of sense. It's like, I was on X, Y, or Z drug, and it just made me feel real numb. And then we get that genetic testing, and it's like, this makes a lot of sense why you felt that way. You don't process this drug very well with your genes, and it can make all the difference in the world. But it's definitely not the goal of treatment.
Wow.
Sure.
So I think I love the idea of genetic testing. I think it can really, it's that preventative medicine piece where you can understand how all sorts of medications would be best for you. So is that something you guys do pretty frequently, Grant, at the clinics?
Yeah, I think we do, probably maybe 80% of the people that come through our day hospital. And then on the outpatient basis, if there have been, somebody has trialed multiple medicines that have not worked, or we've gotten some weird adverse reactions with them, I definitely encourage it. But like Dr. Meier said, on average, most people would do well. No SSRI is better than another per se. It's just what fits best with your genes. And for most people, there were we could have started with a number of them and they would have all worked just as well. So
yeah, one problem we have with the genetic testing is so new that it costs about $4,000. So
wow.
Who can afford that? But when people come in the day program, we get a special deal with the company that does it, where even if insurance doesn't pay for it for them, for the ones that are in the day program, the most that they would have to pay is $300. So if they're poor, they might only have to pay $20 for a $4,000 test, and if they're rich, they only have to pay $300. But I'm not sure how it works for outpatients, but I don't usually get it for outpatients unless, like Grant said, if there's somebody that we've tried 4 or 5 different medicines on, and then it might be good to get it. What I tend to do is, if they need an antidepressant, I usually start them on Prestique. Desvenlafaxine is the generic name, because it passes all the genetic tests. It's the only one that nobody gets a bad score on. So so I start them on that. So they may not need it.
That's a good one. So let me ask both of you this: so obviously not everyone has the pleasure or does not need to come to one of the Meier clinics. So if
yes, they do.
Oh, come on, Paul. Not everyone. Not everyone. You wish, right?
Everyone on the planet.
Well, it would be great, because I know it's a wonderful program. You really help people work through their issues.
I'm teasing. Yeah.
But so, if an audience member is listening to the show, and and they feel like they may suffer from depression or anxiety, would it be okay for them to go into their, say, general physician's office? Because I don't know how it is where you guys live, but in Virginia, to get an appointment with a psychiatrist is like a 4-month wait. I'm not kidding. I've literally told some patients that I felt like were in such a bad situation. I've told them to go to the emergency room because I knew they just couldn't wait that long to get an appointment. But a lot of times you can go to your general physician. So, could someone just walk into their general physician's office and say, hey, I heard about Prestique on Mental Health News Radio. Dr. Paul Meier said it was the best one. Can
you order me some?
Exactly. How well received do you think that will be? What do you think?
I think it would be. No doctor likes being told what to do. Well, some doctors do. I like being told what to do, but a lot of doctors don't like being told what to do. But for most doctors are really nice people, and I think if somebody came in and said, I heard about Prestique on the radio and I'm really depressed, do you think it'd be okay for me to try that one? And the nice thing about that, you see, going to the family doctor for psychiatric treatment is not generally a good idea.
Exactly.
Because they don't have enough training, so they'll put, if you put somebody with bipolar, they don't know that they're bipolar because they don't even know what questions to ask them to see if they're bipolar or not. If you put somebody with bipolar on a serotonin antidepressant, it'll make them worse and they'll have a manic episode. If they have a bipolar relative, first-degree relative, then even if they don't have bipolar, and you put them on an antidepressant, it probably won't work unless they add a mood stabilizer with it. So there's a lot of things that they don't know. So lots of times they'll get lucky and guess right, but it's almost like me agreeing to do brain surgery to save somebody a lot of money. I think they'd rather.
That's a good point.
So, but if like you said, in some places they have to wait several months to get in to see a psychiatrist. I think I would go to a family doctor first if they can't get in to see a psychiatrist and get on something. But if people will listen to our program today, I want Grant to actually share the names of some meds that he thinks are really good. And those of you in our listening family can write these down and maybe you might ask your doctor about some of these, if you need it.
Yeah. You want me to just go ahead and do that now?
Yeah.
Yeah.
Okay, yeah. I definitely agree with Dr. Meier. Pristiq or desvenlafaxine, it's the same drug, just one's the generic name. It's a fantastic medication for anxiety. I think its FDA approval is, they only did the $1 billion study to get the FDA approval for major depression, but it is first-line therapy for panic disorder, generalized anxiety disorder, all your typical anxiety disorders.
And what's the disadvantage? What's the disadvantage of it, Grant, for people so they won't have unrealistic expectations? I mean, it works great, but
yes.
How long does it take to work great?
Some of those, they can take anything will say, hey, it takes about 4 to 6 weeks.
Yeah.
Anytime I start a new medicine with anybody, I have them come back in 2, and I do that, have them come back in 2 weeks because I want them to make sure they're tolerating the drug, they're not having any side effects, that everything is going well, and that they're having what's called a partial response. And I tell people, hey, you're not going to come back in 2 weeks and say, oh my gosh, this Pristiq is the greatest drug ever. Thank you so much.
Yeah.
You cured all my anxiety. But in 2 weeks, I do hope that somebody will come back and say, you know what, I feel a little bit better.
Yeah, they usually get like 20% better each week, which means that at the end of 5 weeks, most people are going to be 100% better, but
exactly.
But the disadvantage is that, I explain to them, you may take this a week or two and think, this medicine that Grant's given me isn't doing any good, but
yes.
And we tell them, be patient, it will.
Be patient. And I explain that too, specifically when they have a lot of anxiety about, is this medicine going to change me? Am I going to be a different person? It's like, hey, here's the great thing. After a week of taking this medicine, I want you to be like, man, I don't know what Grant's talking about. Hey, fantastic. It hasn't changed you as a person at all. You're still you. But what you're going to notice as the drug starts to kick in and make those neurochemical changes is that the anxiety is going to really lessen. And you're going to notice you're not worrying about things anymore. Oh, wow, I haven't had a panic attack in a couple of weeks. Wow. Oh, wow, I hadn't even thought about it. When the absence of anxiety, you're just living life. You're not thinking about all these worries or fears. You're just, living your life like you would your normal self.
No, Grant, do you give them something? The first day there, do you give them something that'll work right away while they're waiting, like a benzodiazepine or something else? I know you don't like to use benzos.
And I'll explain.
I like to use them. I like to use them the first few weeks until the other things build up.
Yes, it depends on what the anxiety disorder is. If it's panic disorder and they're having panic attacks daily, yes, absolutely, I will give them either a benzo, like a clonazepam, or I like to use a medicine called Propranolol, which is a beta blocker, which it blocks adrenaline and actually blocks the physical causes of the anxiety.
It's a blood pressure medicine, Melanie.
It's an old blood pressure medicine.
Yes,
Yeah.
I know. I actually took that because I have the essential tremor or postural tremor, and it was supposed to help with that, but I already have low blood pressure as it is. So
very hard to tolerate.
Yeah, it made me feel horrible. My blood pressure got too low, but I know what that is. I think it's a really, it's used for so many different things.
Mm-hmm. It's got a lot of uses. It's very good for anxiety associated with trauma, because of the way that the neurocircuitry in the brain rewires itself when someone's been the victim of trauma, and that you have your brain has a propensity to release that adrenaline response kind of all the time, and thinks and is constantly scanning the environment for a threat or danger. And even when you're, just sitting on the couch watching TV and essentially should be fine, you can have a panic attack, or you're hypervigilant and looking for things, and it really helps just slow those physical symptoms of the anxiety down. But it doesn't. What I don't like about benzos is that they inhibit the brain's learning. So the brain's not able to learn that the feared response is not something it needs to be afraid of. When you do benzos combined with therapy, they absolutely serve a purpose, and I think that for some people they need them. But over the long term, your brain can't make those connections like, wait, this is not really something I need to fear. And Propranolol does not inhibit that or prevent any of that learning in the brain.
What dose would you typically give, and how many times a day do they give it? Because I'm just, Propranolol wasn't something that I used in my training, so I never use it, but I know it works great. But I just how much do you give?
I always check their blood pressure and their heart rate, and if everything's kind of relatively within normal limits, I usually start with the 20 milligram, and I say, take half to one twice a day as needed. You just want to make sure that I teach them how to check a pulse rate, that if, they want to take a second dose, that their pulse rate's greater than 60 beats per minute. And I usually just say, hey, you know what, start with 20 milligrams in the morning, and let's lower that adrenaline for the day. And, note any dizziness. If you notice dizziness from sitting to standing, that may mean it's lowering your blood pressure, your heart rate too much. I teach them how to check it. But a lot of times, just even doing that one dose in the morning, a lot of people, specifically with panic disorder, will come back and they'll say, oh my gosh, I just feel cognitively, you don't feel medicated on propranolol. You just notice, oh my gosh, my body is not freaking out. I'm not panicking all the time. I'm not shaking. I'm not whatever that anxiety symptom is. But yet they're not, some benzos can cause some sedation or some drowsiness, and propranolol won't do that. Yeah. But there, like you asked, I think the initial question was, do I ever add a benzo kind of initially? Absolutely. If they're having multiple panic attacks a day, I will give them some. I tell them, try not to take it every day if you don't need to, but it is absolutely there. A lot of people just, if they just have it,
when you need it,
they feel better. Absolutely.
If you feel a panic attack coming on, they can take a half a milligram of clonazepam, and it'll be gone in 7 minutes and stay away for 8 hours. And if they're in a hurry, they can chew it, and it'll work in about 2 minutes. But that gives them relief to at least have one in their purse or in their pocket, knowing, because sometimes just the fear of having a panic attack will cause a panic attack. So if they carry a few of those around, then the fear of having one will go away once they've had a couple and see that they do disappear. And the benzos, one nice thing about the benzos is they work 100% of the time and never have a side effect that I've known of, other than if you get too low a dose, it doesn't work. If you get the right dose, it works almost 100% of the time. But if you get too much, like Grant said, it'll make you groggy. So if they take a half a milligram tablet or something like that for their panic attack and it makes them tired, that means half of a tablet would work without making them tired.
That's right.
Yeah. I guess it's possible, too, that some people, Paul, I've taken them for public speaking, because I'll tend to get...
a lot of pastors do it before.
I know, because, with the tremor gets worse, especially if I have to hold a mic when you're a little bit nervous. The essential tremor, postural tremor gets worse. So I feel like they always make me feel, and I'll even take like a half of a half, but it always makes me feel hungover. That's like the best way I know how to describe it. But I don't tolerate alcohol very well either. And it's kind of my understanding that they're I've heard them described as alcohol in pill form. Is that a true statement?
They hit the same receptors.
Yeah.
If somebody was having to detox from alcohol and we're in a detox facility, they'd start them on Valium, which is a benzo, and kind of a process of weaning off of the alcohol. So it's kind of, your brain, really can't tell the difference. So that's always the thing too. I tell people, it's like, hey, if I'm going to give you benzo, you can't drink on this.
Yeah.
Melanie, I think that's one of the things right there. I use it a lot. The propranolol for you, obviously you couldn't tolerate it, but it is fantastic for performance
public
anxiety.
Speaking. Yes.
It is wonderful, because you don't feel those cognitive, the hangover effects. You notice your body and your brain don't want to run out like the building's on fire while you're up there. You just kind of, are able to tolerate it.
Hi, this is Dr. Paul Meier of the Meier Clinics. Our Christian counselors across the country have a goal of helping all those who come to us to become what God has called them to be. If you're in a situation where you're not at peace within yourself, or you just feel like there's joy that's missing in your life, we can come alongside to help you obtain peace and joy.
This message is sponsored by the Meier Clinic Foundation, a nonprofit Christian counseling ministry. The number is 1-888-7-CLINIC, 1-888-7-CLINIC.
Another medicine I really like, if nobody's ever been on a medicine before, I typically seem to start with Zoloft a lot for the SSRI. If they've never been on anything, that's typically my go-to. There have been some studies that showed that is one of the...
It's been around about 30 years, I think.
It's one of the best well-tolerated as far as, the most common initial side effect of Zoloft is some initial stomach upset. that I kind of warn people, hey, you're probably going to get this. It'll last for about 4 or 5 days. It'll be really mild, and then it'll go away. But it's as far as that's really it, and it's very tolerated well, and it also for anxiety it blocks the serotonin reuptake, like Dr. Meier explained earlier, and most people just say, hey, I don't worry about things. I don't have the panic attacks like I used to, and it just helps block those. And again, typically no side effects. Some of these can cause some sexual side effects. Any of them potentially can, except for a newer one on the market called Tranquilizers. That one, the way it works neurochemically, it can't cause sexual side effects. So that is a go-to for anybody who's been on some of these medicines and have had problems with libido or some of those problems. That's also a fantastic medicine.
And Wellbutrin is another one that never causes sexual side effects. It actually improves the enjoyment and other aspects. But it doesn't make you want sex more. I tell if a male tells me he's got sexual side effects, I said I would never get a male. I would never give any male anything that gave you more temptations.
Right.
But you can take an antidepressant that won't hinder it, or that might even enhance the enjoyment of it, but not make you want it more. So
yeah. I feel like that's one of the things that's kind of like stigma carrying because it is a real common side effect. So I think people maybe might decide not to try to take something that would make them feel a lot better for anxiety or depression because of that reason. So I feel like it's kind of a stigma carrier. So it's good to hear that there are some that don't have that side effect. And does that side effect usually last the entire time you're on the medication, or is it just an initial side effect?
Usually.
It could be, go ahead.
Yeah. Well, I said usually if, not everybody will get that. I have
10% maybe, right?
Yeah, it's not.
That's low.
It's not an. It's not an uncommon side effect, but it is definitely a possibility. If you usually get it, you've got it. Like sometimes it's dose related, but if you have libido issues or if there's any other type of sexual side effect, unfortunately, usually it persists. And sometimes we will add Wellbutrin to Zoloft. They used to call that Welloft.
Oh, interesting.
Side effect.
Interesting.
Yeah, lots of times that fixes it.
Yeah, because Wellbutrin by itself, for some people it helps anxiety, but a lot of people, Wellbutrin alone will make anxiety worse because it doesn't. Yeah,
it doesn't touch anxiety. I don't think. Just helps depression.
Just depression.
So I wouldn't give people Wellbutrin if they had a lot of anxiety and depression. I'd give them Wellbutrin for the depression, but I'd give them an anxiety medicine with it, like Lamictal is probably my favorite medicine in the whole world. It's not addicting. If people have, if somebody's got a lot of anxiety and we start them out on a real low dose and build it up slow, and they don't hardly notice any benefits the first couple of weeks, but when they're on it for about a month or 6 weeks and get it on the right dose, the panic attacks are gone, the irritability's gone. It decreases physical pain if you got arthritis or anything else. It's just it prevents bipolar. It's the best bipolar medicine, and that along with Wellbutrin together are just a dynamite combination. But again, the first 2 or 3 weeks you're on it, you don't think you're getting any benefit. So.
Yeah. What are some others, Grant?
Zoloft, Prestige, Tranquilizers, mentioned that. Love the Propranolol. Trying to think, kind of ones I don't use. I don't use Paxil.
Never.
Childbearing women.
Plus Paxil is really hard to get off of. Everybody has really bad side effects, and a lot of people gain weight on it, and so I haven't used it in 20 years.
Cymbalta is a good medicine for anxiety, also FDA approved in teenagers, if I'm not mistaken.
One more thing. Let me butt in. You can tell I love to butt in, but as you share things, I think of things that are related to it. One nice thing about the antidepressants, the serotonin antidepressants, and some antidepressants are SNRIs, which is fine too. They build up two chemicals. But one nice thing about the antidepressants is whatever dose normally would get rid of depression. Like for like Zoloft, Grant mentioned, Zoloft usually takes 50 milligrams a day or 100 milligrams a day to get rid of depression. Usually, some people need more. But if somebody has OCD, obsessive compulsive disorder, where they have to repeat check the doors 4 times a night and do everything in twos and all sorts of rituals and things, they need a double dose. So somebody with OCD, if I put them on 150 or 200 milligrams of Zoloft, then the OCD will go away almost either totally or it gets a lot better or it doesn't bother them anymore.
Mm-hmm. Yes. There's also interesting. There's been some evidence for people who just want any type of medicine, but a supplement, an amino acid called N-Acetylcysteine, has some.
See, I've never even heard of it. See, that's what I mean.
I know, Grant. Do tell. I'm so interested in stuff like that. Talk about it.
How do you spell that? I've never even heard of it.
N-acetylcysteine is an amino acid, or they call it NAC.
How do you spell it?
So N and then dash acetyl, ACETYL.
Oh, yeah, N-acetyl.
Cysteine.
Cysteine. Oh, yeah, okay. CYSTINE. Yeah.
You can get it, at your every vitamin shop. You can also get a pharmaceutical grade NAC, but it's expensive because insurances don't like to cover the quote unquote medical foods.
Yeah.
But there has been a lot of systemic reviews that show 2,400 to 3,000 milligrams a day in divided doses of this amino acid can significantly improve intrusive obsessive thoughts and OCD and then compulsions and the need to act on them.
Cool.
So anybody
I didn't even know that.
OCD, well, I'll tell them, they've never been on medicine. We'll start them on Zoloft. I'll tell them about that supplement. And can I tell them, hey, I'm going to keep you on the lowest effective dose, whatever is, I'm not going to, just because you have OCD and, hey, the thought is you got to go to 150 or 200. If you're feeling great on 100, we're going to keep you on 100.
Yeah.
Kind of prepare them that, hey, we may end up on the higher end of the medicine.
Do you prescribe that whatchamacallit, N-acetyl, whatever it is?
Typically.
Did you prescribe it or can you get it over the counter?
I typically say, hey, go check out a vitamin shop or a GNC and see if you feel like it's helping. And if it's not, then I'll get you a prescription for it.
Or can they just write off to Canada and get it really cheap?
I'm sure they could. I can have a patient who's getting her Latuda in Canada, so I'm sure you can get it somewhere. But I think that the same people who make the Deplin also make a NAC supplement, a Serotonin NAC. But
that's nice to know.
Yeah, so it's but that's one that's a supplement that I will tell people, hey, this is not like, hey, not that anything's wrong with essential oils, but this is not like, hey, rub some lavender on your feet, all your anxiety is going to go away. This has some research behind it. They've done clinical studies.
Yeah.
So
I do recommend. I've got a chapter in my book. I wrote a book called Blue Genes, GENES. In chapter 10 in there is a nutrition chapter, and it tells which foods you can eat that'll build up tryptophan for serotonin or serotonin, norepinephrine, dopamine, and those things. It'll show which foods can build those up to help anxiety or ADD or whatever it is. So that's something you might want to get. People might want to get.
Yeah, it's in that book. Yeah, would you say it was chapter 10? 12.
Yeah, I think it's chapter 10.
Okay.
You probably know it better than I do. You got your photographic memory over there.
Yeah. But yeah, that N-acetylcysteine is a good supplement for people with OCD to take. I don't know of any evidence, of anybody that takes that alone and just has these amazing OCD benefits to it. It's usually all my experience with it is in conjunction with an SSRI or an SNRI.
I've never seen an OCD patient with the genetic kind of OCD that can get over it without medicine. There's some people that are not OCD their whole life. They don't have it, but then they have a car wreck or some crisis, and they temporarily have OCD, and they can get rid of that even without medication, with counseling. but medicine would still speed it up, and then they could drop the medicine later when they got counseling. But the people that are born with it, from the time they're little babies, they're lining up their toys and and stuff like that. The ones that are born with it have to have medicine the rest of their lives, and then it won't bother them if they take medicine for it.
Yeah, and like Dr. Meier said, lamotrigine is a good medicine, or Lamictal, same medicine there, can be used for anxiety and various issues. I'm a little different with Dr. Meier. I tend to not use that one alone. It's usually an adjunct, or meaning something in conjunction with an antidepressant or something like that.
I usually use it with something. Yeah, me too.
Yeah. Use it with something, but it's a good one. Cymbalta, we were talking about, it's a serotonin norepinephrine reuptake inhibitor, very good for anxiety. Also, shown to help with like some neuropathic pain. So people who have, fibromyalgia, and usually I think, depression and anxiety are pretty co-occurring with that. Not everybody with fibromyalgia is going to have depression or anxiety, but
people with pain. There's only two antidepressants that are really, really good at getting rid of physical pain, and that's Pristiq and Cymbalta. But I guess there's some other one. I guess Effexor could probably help some.
Yeah, Fetsima is one of the newer ones too. It's they used a drug called Savella or milnacipran over in Europe for the neuropathic pain, kind of like we use Cymbalta, and that's what Fetsima is levomilnacipran. So Fetsima is also another one of those SNRIs that's supposed to kind of help with fibromyalgia type. I don't think it has that FDA approval for that, but
I never knew that. See what I mean, Melanie? This guy's a walking encyclopedia.
He really is.
I've never heard of half the stuff he's telling us. I've never heard of. And I've been doing this 42 years,
Well, he probably went to school.
Ahead.
He's younger than you are, Paul. So he knows all the stuff, all the new stuff. Exactly. Fresher education.
Fresher. Right.
What about the major tranquilizers? Like the major tranquilizers, they're called, I wish they wouldn't call them that. They call them atypical antipsychotics. So everybody, that you give them some, Seroquel or some other major tranquilizer, and it gets rid of their anxiety overnight.
Major tranquilizer.
Yeah, within a couple. I call them major tranquilizers, but if they take one, it can get rid of their anxiety overnight. They can sleep good for the first time and all that sort of thing.
Yeah.
But then when they look it up, they come back and say, "You didn't tell me I was schizophrenic," and I said, "You're not schizophrenic. We use it for a lot of different things." So, when do you use a major tranquilizer?
Majors, yes. So I will use those. OCD, definitely. There's some indication that I used to work with eating disorders, and we used to call that line of medicine, we would call it brain glue. Because there's I'm not saying people with eating disorders or OCD are delusional per se, but there is a very delusional nature to the illness. This thought of, I had this obsessive thought, and then I need to do this compulsion. It's on that delusional end, if you will.
Yeah.
Like,
and they think they're fat. They think they're fat when they're 5'10" and weigh 85 pounds.
Exactly. And so those medicines, when it's very severe, can be very helpful to kind of help just bring some of that delusional thought, make the thoughts much more clear and better able to rationalize some of these things. And so I will use it definitely for that. Seroquel can be good. It works similarly in some people with PTSD, like it has some alpha antagonist properties, which just means there's some medicines that can help with PTSD nightmares, and Seroquel has some data that it can help with that, and then also help you sleep, which for a lot of people with anxiety, that is absolutely one of the big symptoms of anxiety is insomnia or not feeling rested when you wake up. And so I will use Seroquel. And
if people have trouble sleeping, there's three sleeping pills that are not addicting. Sonata is a real mild one that just helps you fall asleep. Lunest is a good one that works about 6 hours, and if you got an emergency call in the middle of the night or your kids needed you, you'd be able to wake up and help them out, and then it'd just be easier to get back to sleep. Then there's Ambien that knocks you on your rear end, and So I don't usually prescribe it unless nothing else works. But I mean, yeah, it works fine for 9 out of 10 people. But then if none of those work, there's some people that have such severe insomnia that they just can't sleep more than a couple hours a night. And for any of us, if we go without sleep, we're gonna go nuts, you know. And so I'll climb up on Seroquel and start at a low dose and work my way up until there's a dose that works good to help them sleep through the night, relaxes them the next day without making them tired, because it usually makes you tired the first few days you take it.
Yeah.
But it works great. It's not addicting, and it works great. And it stops bipolar, it stops anxiety, stops panic attacks. But what's the reason that we don't use those more? I mean, are there some long-term effects
with the Seroquel? Is that what you're asking? Yeah. I think long term, usually at the doses we would use Seroquel with, at the 25, 50 milligram range, there's not some metabolic effects, like it can increase fasting blood sugar, it can increase cholesterol.
It can make you crave carbohydrates.
It can make you crave carbohydrates.
So it can make you gain weight. But the average person gains 5 pounds in a year, so it's not too bad, so.
Yeah, not horrible. For some people, though, it will be significant, but that's a small percentage.
If any of you get on a medicine, even some that don't ever do that, if you get on a medicine from your psychiatrist or your family doctor and you put on 40 pounds in 5 months,
you gotta
then
let them
get
know.
off that one and switch to something else. Don't just keep taking it.
You gotta let them know. That's not good for multiple reasons. But yeah, I think probably just the class of medicine that is, Dr. Meier, just kind of this, because it is an atypical antipsychotic, and that's probably why we don't use it as much. It's just kind of, it's like, I use trazodone a lot for sleep. That's also a non-habit forming, non-dependency sleep medicine that a lot of people will sleep well on.
Some people get tired the next day on it, but not everybody does.
Yeah. That's a good question. I don't know why we don't use it more. I think some people I've had more experience with some people with Seroquel that, I took 25 milligrams and I slept for 15 hours. And so maybe there's just a tendency to be like, oh, okay, we don't want you doing that either. So, but. And
if I saw a new patient in a hospital, which I don't do hospital work anymore, but if I saw a new patient that for 2 or 3 straight months in a row, they're hearing voices that aren't there. They think they're Jesus, and they're just psychotic as all get out. You can put them on 600 milligrams a night of Seroquel, and they'll be zonked for a few days.
Yeah.
But at the end of about 8 days, they wake up and they're normal.
Yeah.
It's gone. I mean, it's amazing. It's just like like a miracle drug. And but we use it in small doses, like Grant said, like 25 or 50 milligrams, to help people with their OCD or with anxiety or with sleep, or if they're stuck. If somebody's on an antidepressant and they get well, they get a lot better, but not quite good enough.
Yeah.
Then the advertisement on TV, like for Abilify, for example, they advertise, "Are you stuck in your depression? Add Abilify." They're actually telling the truth. It does work.
Absolutely.
You add a tiny little, like the normal dose is 15 or 20. If I add 2 milligrams to somebody that's like 3/4 of the way well from their antidepressant, then usually within a week or two they're 100% of the way.
Now, can either of you kind of explain in layman terms what does Abilify do that can help another antidepressant work better? Is it way too complicated?
I just know what works and doesn't work. I don't know why. I don't know why they work.
You're right. So there is a lot of that's a good question, and I think, if I'm not mistaken, a lot of it is still very theoretical.
Okay.
And it's kind of, we think it does this. So we know that class of medicine is called a dopamine serotonin antagonist, is what that class is called. And so the thought is that it causes some blocking of certain serotonin receptors, and then that causes a kind of a downstream cascade of other effects in the brain and all these kind of.
So it's complicated.
It's complicated, but
it basically makes dopamine work better, though.
Yes.
In the long run,
yes.
And dopamine is the pleasure chemical.
That's right.
So it gives you dopamine helps you to enjoy life more and have more pleasure in life, and and relax more, and it helps get rid of paranoia. And so if somebody's delusional, it makes the delusions go away at the right dose. And some people are born with paranoid personalities where they may be pretty normal. They're not delusional, but they're real controlling and condescending, and they're always right and you're always wrong. And critical, a lot of them become executives of companies and stuff, because some people that are arrogant, other people believe them. I'm not sure why they make it to the top, but people that have a lot of those traits, it's amazing. Sometimes some of those traits are genetic, and sometimes I'll put them on a low dose of one of the major tranquilizers, and in a matter of a couple of weeks, they're a lot nicer people. They're a lot less that way.
Yeah,
just genetically.
Is there a go-to for access to, or that's, I shouldn't say that on the show because our listeners aren't going to know what that means, but just personality disorders in general, personality
usually
disorders. Not. Is there a go-to medication for personality?
I use Lamictal a good bit.
Okay.
Yeah, for if I'm suspecting an Axis 2-ish personality disorder type stuff, Lamictal, Trileptal, that mood stabilizer class.
Why do you think
that makes sense? That makes sense.
Why do you think that helps? Just because they become less irritable or something?
I think so. I think it's some of it because there can definitely be some some of it if it's purely personality disorder, right? Those will be I've tried 1,000 medicines and none of them have helped, and that's when it gets your radar going. Okay, well it just an issue with serotonin just may not be the dysfunction, and then we try the calcium channel. Let's work on the sodium channels. Let's work on glutamate. Let's work on some different neurochemicals and see if there's not maybe this is just not explaining. Maybe it's just not what your brain needs.
Yeah, I told a patient this week. I told them. I said, because they were feeling great, and they felt horrible a month ago, and I said, well, my job as a psychiatrist, I sort of see myself as a chef, trying to make really good soup or really good cake or something. And so I'm giving you a little bit, after I get to know you for an hour, I think, well, this guy could use a little bit more dopamine and a little bit more serotonin and maybe a touch of norepinephrine, and it's sort of like mixing ingredients in a soup. And so I'll give him the medications that help his brain hang on to the ones that he's low of. And then, like we said before, he becomes his normal self. And the normal self, people are surprised at how nice they can be.
That's right.
Yeah, that's interesting. I see that makes sense to me for personality disorders, because to me, personality disorders are about mood dysregulation. And so there's it's kind of your feelings take over your life. That's why they're so pervasive. So that makes sense to me. Boy, that's something I feel like you should do a workshop or something on, Grant. That you should, help, because personality disorders can be so tough for. I just went to a workshop, treatment strategies for cluster B personality disorders, and half of the workshop really was about neuropsychiatry and understanding the brain and the dysregulation. So I think a lot of
because they will,
go ahead.
They will inevitably start with a psychiatrist. They'll be in therapy, but some of them will be.
Some of them, not a narcissist, but that's another show.
Exactly, yes. Or a sociopath won't, but your borderline, your histrionics often will be, and there's a lot of self-harming and things that rightfully so. You'll say, hey, you need to see somebody about medicines because of safety issues, and just there can be so little success at times on our end of. But
some personality disorders just don't respond to.
That's right.
That's what some do. Go ahead. I didn't mean to butt in.
Yeah. I just find that mood stabilizing category can really help. The Lamictal, the Trileptal.
And the mood stabilizers basically work on GABA. There's a chemical that God put a whole bunch of in our brains called gamma aminobutyric acid, GABA, and it puts the brakes on your worries. And so if our GABA is working right, then it sort of puts the brakes on our worries and helps us to relax more and things like that. One thing that I want you to cover that Grant's really, really, really good at is ADHD meds.
Let's talk
do people
about
need
that.
them?
Then we'll have
and
to
which ones do you recommend? And who should not take them? And
Okay.
Because we're down to our last, 10 minutes
10
or something
minutes.
like that.
Yeah, I'm so interested. Let's talk.
Do you
So
want me to
that's
do that
really
now
important.
or for a separate
Yeah.
topic?
Yeah.
No,
no,
right
let's
now.
do it.
Oh, yeah.
Let's
We'll do a
start.
whole
Okay.
we'll do a whole program on it later.
Yep.
Okay.
Let's
But
get the
why don't you give them some?
conversation
Yeah. If Vyvanse is probably my go-to first line for ADHD treatment. It's because it's just there's not a true peak in the medicine or so you get some people with these short-acting Adderalls and Ritalins, they take you up real fast and then they can just drop you off and you get this crash. And Vyvanse just doesn't do that. It's a very smooth medicine that works by boosting dopamine and norepinephrine primarily to the frontal lobe, which is where, what we theorize is where the dysfunction in ADHD comes from, is not enough dopamine and norepinephrine right there where the executive functioning of the brain takes place, or the starting things and finishing them and not jumping around and keeping your attention.
I take Vyvanse every day for my ADD, and I literally get twice as much done if I take it than if I forget to take it some morning. I can still plug away.
Highlighting that you're not
really
trying to be highlighting that you're not trying to be Superman by taking Vyvanse, is that it helps you to get done what if you didn't have ADHD, like what a normal, not a word, but what someone without ADHD would be getting done. That's what it helps you to get done, instead of spending 5 hours after the workday in the office trying to get your charts done, right? Like you come in and you stay focused and you don't have the squirrel moments and the distractions and all that. And, but Vyvanse
it lasts about 12 hours.
Yeah, that's kind of the goal.
And,
and
you can take it with or without food.
Exactly.
Adderall and Ritalin work fine, but they you have to take them without food to work really great. And like Grant said, they'll start low and then build up to a peak and then go back low again, and they're not.
Yeah, it just kind of leaves people feeling crummy. There can be a kind of a stimulant withdrawal effect where people get really crabby when the medicine starts to wear off. Irritable.
They work great on most people.
Yeah. But Vyvanse is it's a smoother medicine. It lasts. And the hope is, if you're a teenager or a child, some of these short-acting medicines you have to give them to the school nurse and you got to take them at school. If Vyvanse works well for somebody, what's great about it is you take it in the morning and it lasts through school or it lasts through your work day. And then, and then if you're really lucky, you come home and you've still got some left for your family.
So it works from 8 in the morning to 8 at night. Yeah.
Right.
The trouble with it is if somebody doesn't have insurance, it's about $300 a month.
Yeah, it's expensive.
It's expensive.
But if you do have commercial insurance, they have a good discount savings card that can make it
$15 a month.
Yeah. But it is. If you were going to have to pay cash, what I tell people is that there's a ton of ADHD medicines on the market, but when you really break them down to their core molecule of what the drug is, it's still just Ritalin and Adderall. And what they've done is they've just taken that molecule and they've made the delivery system a little bit different, or its length of action a little bit different, and with some different chemical structures onto it. But when you break it all down, we're still Adderall and Ritalin is the options that we have.
And how do they help anxiety? Because that surprised me. That sometimes they seem to help anxiety, and I'm not sure why. I think it's because when people are getting stuff done,
absolutely,
they feel less anxious about not getting their work done or something. But I'm just guessing. What do you think?
Yeah, no, absolutely. Same reason that we start a stimulant on somebody, and so something that would promote wakefulness, and they get the best night of sleep in their life that night because they don't go to bed thinking, there's 6 things I didn't get done today, and I got 10 more to do tomorrow. Let me add that to the list. And people stay up thinking about everything that they did not get done and everything they got to do the next day. And when you treat ADHD for the first time and you get your stuff done, you go home and you sleep amazing. But that's how it helps anxiety too, is because there's a lot of co-occurring anxiety with untreated ADHD because there's this constant, I'm going to get fired. I'm constantly asking for extensions. I can't get my work done. I can't find anything. I've lost my wallet again. I forgot to pay the electric bill. All these things that it just causes anxiety.
Stress.
Stress. And so when you finally treat it, it can just be this amazing reduction. And I think with people with ADHD too, there's a lot of racing thoughts that the brain's just going so fast sometimes. And these medicines just kind of slow the brain down. You can focus on one thing at a time instead of 1,000.
Yes, I think that's a big piece of the anxiety part. I mean, I can attest to that. I know my 17-year-old takes Vyvanse, and the first time, within a week of him taking it, we were in the grocery store, and he had gone from being this very, outgoing kid that was always very talkative and well-known to just literally not saying much of anything to anyone. It was just complete personality shift. And we were out one day at the grocery store and we were checking out, and then all of a sudden he just started talking to the cashier. And I turned and looked at him and I was like, there's my son. Like, I have not seen that boy in 2 years. And he was just talking away. And so I asked him about it later, and that was the thing he said, that it just wasn't, he was constantly thinking about things in social situations, kind of that rumination of thought. And so it was just always this, social anxiety. He feels like it really, really helps. If he has to do something social, he'll actually take one, because he swears that it makes him, feel less anxious out in public. It's interesting.
It slows the brain down a little bit, I think, for people with ADHD. I don't think if you did not have ADHD, I don't think you would get that response.
Yes.
I think it would amp you up, and it would really, you would be even more anxious. But the ADHD brain, it really seems to have an effect where it just slows thoughts down, and there's a lot of co-occurring, I think, circadian rhythm disorders in people with ADHD, and that, they get this, I'm not alert in the morning, and then, I could be thinking about, man, I can't wait for bedtime, and then something about 7 or 8 p.m. and the brain just activates. And it can be, I see a lot of, the way that melatonin is regulated in the brain. You are relating to that?
I'm relating to that because I've got really bad ADD. I mean, on my testing, I score about twice as high as the people that I treat for it, and I love video games. I mean, I don't obsess on them or anything, but I like to play video games, and if I play it when I get home from work at about 6 o'clock or so, then I lose a little bit more than I win, more often than I win. But the longer it gets in the evening, when I'm playing from 11 to 12, I'll win about 2/3 of them. Maybe it's because the other people online are drinking. I don't know.
It could be.
Or they're tired.
But it seems like what you said is true. That's why I laughed. It seems like what you said is true. My brain gets better late at night than it is during the day.
Interesting.
It can be,
Wow.
So, you look at that with, is there something with when your brain starts secreting melatonin, and then when it shuts it off, and can there be some dysregulation in that process? So sometimes when there's an ADHD and I'm suspecting a circadian rhythm issue too, I'll say, hey, try just supplementing with some over-the-counter melatonin. See if you don't start winding down a little bit earlier, and see if that helps you when you wake up, if you don't feel a little bit more refreshed, and just some of those things. So it can be helpful.
I can see where that would just snowball. I mean, that if you think about that pattern of someone that's never been medicated for ADHD, but they're ADD or ADHD, they get to 7 o'clock at night, their brain's activated, they stay up all night, therefore they don't get the sleep they need because they have to get up and go to school or work, and then it just compounds this
makes the concentration
problem
even worse.
Oh, yeah. I could see where that could just snowball into a really bad situation,
Absolutely.
Yeah.
Absolutely.
Yeah.
I don't know was there anything else you wanted me to talk about with the ADHD medicine, Dr. Meier?
Not really, just a overview, because like you said, we'll probably do a whole program on it sometime.
Oh, yeah.
Yeah, those shows are always downloaded a bunch, Paul, so we should definitely, I think so many people have it for sure. Yeah.
I especially, I mean, the only reason I wanted to add that to what we were talking about today is because it does help. You don't think of a stimulant as being an anti-anxiety medicine.
Yep.
But sometimes if you have ADD, it can decrease your anxiety because you're you're organized, your thoughts are organized, and you get stuff done. And a lot of people go from a C average to an A average. And
Right.
I had a guy that worked at Starbucks that was he said, I got to get on some ADD medicines. I'm getting ready to get fired. And so he got on them. And 3 months later, this is a true story. 3 months later, he was promoted to manager.
That's awesome.
Now that's an
Wow.
unusual story, but
Yeah.
it's just such a turnaround for him that.
Yeah. Well, if there were a few last words, Grant, that you could say if you're thinking about our listening family, what would you say overall about medication and moving forward and how they can affect your life?
Yeah, I think for people with, like Dr. Meier started off, every person that has anxiety or anything like that does not mean that they necessarily need medication. And if you're really struggling and you want to start with therapy, that's a great place. That may be all you need. If you are wanting to consider medication, and you're in the Dallas-Fort Worth area, call Meier Clinics or any psychiatrist or mental health specialist and, go to somebody and let us talk you through the process. But, the biggest things that I get, the fears are, this medicine is going to change who I am. And this thought that we're providing some synthetic form of a neurochemical to their brain that's just going to make them medicated. And that is absolutely not the case. And that, when you have, anxiety that affects your life to where it would be diagnosable, with the goal is to get you back to your normal self. And so that you can enjoy the wonderful things that, as believers that God has given on this earth, and to enjoy your family, enjoy those things that just anxiety can absolutely rob us of all of the enjoyment of everything God's given us. And that's what the goal of getting on some medicine sometimes is to bring that back so that we can, not ruminate about, hey, I've prayed about this 1,000 times, yet, you just can't let it go. And just being able to say, you know what, I've prayed about it, God's got it, and, I'm gonna let it go, or whatever that situation is that don't go and talk with somebody and let them explain how medicine works. It's kind of what I would encourage.
And the Bible says laughter does good for you, like a medicine does. And there's times for people to use medicine, times not to. And I do want to give one encouraging word to everybody in our listening family right now that, like Melanie said, sometimes it takes a couple months or 3 or 4 to get in to see a psychiatrist, depending on where you live. Here in Dallas, it's usually a couple months. But if there's anyone listening to us right now, or someone that you love, that if they're having enough anxiety, panic attacks, depression, that they're missing work, that it's really severe, and they're missing work or feel suicidal or things like that, call our number, 1-888-7-CLINIC, 1-888-7-CLINIC, and you can come down. You can, no matter where you live. I had 2 patients come here from Jerusalem on the same day one time to get treated at our day program. But you can come to our day program and get in. Like if you called today and you needed to get in right away, you'd probably get in within 2 days. And I would do a 1-hour workup, and Grant would see you every day for medication for 3 weeks. And so we'd get you started in the right direction, and you could go home and be on some great meds that your family doctor could continue until you did get in to see a psychiatrist back where you live.
Yes, good point.
Yeah, that's some good advice. And then that also makes me think just another last point is, if you believe you're suffering with anxiety or depression or have ADD or ADHD or anything, you feel like you're not mentally as well as you could be, don't wait until the last minute, because oftentimes it is so difficult to get in for you to see a psychiatrist. So don't wait until that depression turns into a complete, can't get out of bed in the morning. So when you start recognizing that you're just not feeling like yourself, and that was something I used to say to my clients a lot was, or when I would hear someone say, I don't feel like myself, then I would start thinking about, well, this might, be something that we need to think about medication for. So there were kind of little terms or keywords that I would listen to as a clinician. So that's just my advice. Don't wait until things get so bad. If you're having panic attacks, go take care of it right away. If you've had more than 2, go take care of it, because that can completely get out of hand. That can start the pathway to depression later on. So just if you feel like there's something wrong, don't wait till it gets so bad that you thinking that you can overcome it yourself, that you really get yourself in a bad situation, because then it's going to take that much longer to pull you out of it. That's kind of my thought with not being able to get in as quickly as you'd like.
Yep.
Yeah. Well, thank you both so much for coming on the show today. And boy, Meier Clinics is lucky to have a team like you two. And I can't wait to have you on again, Grant, and dig deeper into some of these topics. Yeah. Yeah. Thank you, Paul.
Yeah. I'd like to have them come back and talk about antidepressants and some of the other types of medication situations that we get into.
Yeah, that would be
love it.
great.
Appreciate the opportunity. Absolutely.
Yeah. Awesome. Well, thank you guys again. And I want to thank our listeners for tuning in to another episode of Mental Health News Radio.
We hope you enjoyed this podcast. Tune in next time for another engaging discussion on relevant mental health topics. If you have any questions about Meier Clinics, please visit our website at meierclinics.com. That's MEIER clinics.com, or call us at 888-7-CLINIC. Don't forget to leave us a review on iTunes, Stitcher, or any of your favorite podcast apps. And please note that we are a member of and produced by Mental Health News Radio Network, MHNRnetwork.com.